Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
COVID-19 isn't just killing people. It's also putting massive pressure on a healthcare system that also has to deal with many other conditions.
But I think the second piece, which is equally important, is the number of layoffs and furloughs and other things that occurred where people have lost their health insurance as well.
One of the downstream effects of COVID-19 is that, many individuals are concerned about contracting the virus, so they're postponing their checkups, and as a result, there is a risk of seeing more and more later stage diagnoses.
And so you have sort of this double whammy where the healthcare systems have hemorrhaged millions of dollars, and now you have an increased need as well. It's created quite a challenging atmosphere.
I'm Sarah Fenske. This is St. Louis on the Air. You probably know Dr. Alex Garza as the head of the St. Louis Metropolitan Pandemic Task Force. But while that job is huge, it's only part of what he does. He's also the chief medical officer for SSM Health. And in that role, he has to care about not only COVID patients, but people suffering from all sorts of other illnesses. That includes cancer. Deaths from the coronavirus nationwide have topped 210,000 this year already. But cancer continues to outpace the virus. To put it in perspective, more than 600,000 Americans died of cancer last year. Many more survive and need intensive treatment to do it. And that's where hospital groups like SSM come in. Now, one woman who was recently treated at SSM Health is Cindy Fricke. She is a St. Charles resident, and here's what she told us about her battle with the disease.
I took a normal, just annual mammogram in June of 2018, and it was discovered I had breast cancer. And that was at SSM, of course. I went through chemo and radiation and also had a partial mastectomy. Because I was basically over the cancer before COVID, anything that I've gone back to SSM for has been just my normal checkups that you get as being a cancer patient. So I'm just like anybody else where, you have to check in, get your temperature, and make sure you wear a mask. And, no one goes with you. So I would say that's just like most people are having to deal with when they're going in. And also, there have been a couple more virtual actual appointments that I probably would never have been asked to do had we not had COVID.
Now, Cindy Fricke is not immunocompromised. Her chemo sessions are over, so she tells us she's at no greater risk than the rest of us. And she's thinking about the big picture. On her mind right now is funding for cancer. And so we asked SSM Health cancer patient Cindy Fricke why she thinks it's so important to keep oncology funding and other cancer patients in mind.
1 in 8 women get breast cancer, and I was shocked by that. I did not know the statistics were that, and but any cancer, of course, any funding for cancer is wonderful, and that's one of the things that my husband and I have done to give back is to donate to SSM ourselves because we were treated so well, and the money can just go to wonderful things. The support you can get from people, meeting other patients that have cancer, and getting to know their lives and some of the things they're going through. It's just nice to have that support of other people. And I know I talked to one woman whose husband had been in the cancer treatment with me, and now she has cancer. And I reached out to her, and I can't see her, I can't be with her, but I can at least talk to her, on the phone and just give a ray of hope.
And that's Cindy Fricke. And joining me today to talk about the work of caring for cancer patients, even during this pandemic, is Dr. Alex Garza. Dr. Garza, welcome back to the show.
Thank you, Sarah. Glad to be here.
And we're also joined today by Paul Ross. He's the president of the SSM Health Foundation that raises money to support SSM Health. So, Paul, welcome.
Thank you. It's great to be here.
Dr. Garza, I want to start by getting a medical perspective here. What extra risks does COVID-19 pose to people who are dealing with cancer in the throes of chemo and in the thick of that battle?
Yeah, that's a great question. So, you have to think about this on what chemotherapy is actually doing, and it is suppressing the immune system. So, we of course identify that, we treat that during the course of chemotherapy, and so some of the same sort of techniques that we use to protect chemo patients, and sort of even outside of COVID, before COVID system or before the pandemic even started, we were doing the same sorts of techniques, which is, sort of the social distancing and mask wearing and not going out as much in public, things like that. And the reason for that is to decrease the risk of community-acquired infections. So if you go into the hospital and you see chemo patients that are severely immunocompromised, you almost see the same setup that we have with our COVID patients, which is the practitioners have to wear personal protective equipment, make sure the airflow is correct, all of these things. And the reason for that is to protect them from infection because we know their immune system is compromised. And so that's even more, precedent here during this COVID phase when many patients that are on chemo living, they're outside of the hospital, are having to confront all of those challenges now with a virus that's circulating around in the community.
So, Paul Ross, I'm interested to get your perspective. What does cancer care look like at SSM facilities these days? Has COVID-19 made things significantly more challenging in treating this population?
Yeah, absolutely. One of the downstream effects of COVID-19 is that, many individuals are concerned about contracting the virus. So they're postponing their checkups. And as a result, there is a risk of seeing more and more later stage diagnoses. So as you know, when cancer is diagnosed later, it can be more aggressive and difficult to cure. But the 5 pillars of SSM Health cancer care still remain. We organize our care sites by expert capabilities. For example, we've got 9 SSM breast cancer centers in the St. Louis region. And in 2019 alone, these centers gave about 59,000 mammogram exams.
Wow.
Yeah. So, our pillars are the way we care remains the same and remains constant.
Paul mentioning this idea of people postponing these screenings. Obviously, we were all told try to stay as distant from others as you can and, avoid unnecessary trips to places where you could end up being exposed to the coronavirus. It's now been 7 months. Dr. Garza, would you like to see people getting back on sort of these regular screenings?
Oh, yeah, of course. In the interview that you aired, of course, the cancer was discovered by a routine mammography. And so that really shows the importance of a robust screening program. Go ahead. I'm sorry, Sarah.
It feels like in the beginning that we were all kind of terrified that being in any sort of healthcare setting, that COVID just might be flying around and, you're worried that anybody who'd come in might infect the entire staff or infect other patients. Right. Now that we're 7 months into this, do we have some protocols in place where we're feeling pretty confident that's actually not going to happen?
Yes, absolutely. And so going into a healthcare facility now is a much different feel than it was pre-COVID. So a lot of extra precautions are taking, such as symptom checking, temperature checking, the staff wearing personal protective equipment, regardless of if they're working on a COVID floor or not. All of these things are designed to, decrease the risk of any transmission occurring at a healthcare facility. And by and large, it's been very successful. If you look at the rates of transmission occurring inside a healthcare facility, they're extremely low. So that tells us that we're doing the things right.
So all those added precautions, Paul, do we have a sense, does that affect the cost of care?
Well, I'd actually defer to Dr. Garza on that, but it does pose new challenges for us, especially in terms of the fundraising piece. Being creative, being innovative that way. So there are some new challenges in that regard.
Well, tell me a little bit about those. I know a lot of us are sort of watching, white knuckling it as we watch the stock market go up and down. We may feel like all our investments are being wiped out. Is this something that makes it harder to persuade people? Yeah, there's a really good cause you care about here. Please give.
Yeah, absolutely. And there are some significant challenges facing philanthropy in this environment. First of all, being innovative. In our world of fundraising, lots of philanthropy is built on relationships and engaging supporters. And that's traditionally done through events and galas and in-person tours, and most impactfully, in-person meetings. And of course, this has changed over the last 7 months. So we're having to get creative using social media, doing Zoom meetings, virtual meetings, and actually an old tried and true, what's old is new again, is actual mailings and doing direct mail. We've seen a significant response and actually gained over 1,000 brand new donors in response to our appeal for our new urgent response fund to meet the pandemic.
So you guys are finding new ways to reach donors, and it sounds like some of them are working. You also mentioned this gala, and we do want to mention that SSM Health Foundation's virtual gala is coming up. This supports oncology, the most vulnerable among us. You can find info. This is at givetossmhealth.org/events/gala. There's a lot of information about how you can participate in that, and you can do it virtually. So, Dr. Garza, this isn't just that medical providers are doing things differently. People are doing things differently across the entire hospital group. But I want to speak specifically to that, the actual provider side of things. How have you seen your team at SSM respond to just these ever-changing and sort of complicated situations this pandemic has brought?
Yeah, well, it's certainly established a new normal, I would say. And so it really depends on which phase of the pandemic you were in. So early on, as everybody understands, extremely stressful, shortages of personal protective equipment, all of those things just creating a lot of anxiety amongst the workforce. We had a little bit of a lull, now a little bit of an uptick in cases and admissions. But through all that time, I think people have maybe not become comfortable, but certainly understand more about the virus, how to treat the patients. We've been able to increase the amount of personal protective equipment, establish protocols, all of those things. And so I don't want to say that people the anxiety is not there. It's still there. But I do think that we've grown accustomed to this is sort of our new normal until this pandemic goes away.
And I had earlier directed a question to Paul that sounds like it would be better directed to you. Does this has the cost of care gone up with all of the complications you guys are now dealing with?
Yeah, so a couple of things about that. So as I refer back to early on in the pandemic, when the healthcare systems more or less shut down except for taking care of very acute cases, that took an extreme hit on the financial side as well. And so millions and millions of dollars were lost because of that. So that's one thing. There's a huge financial hit to the healthcare systems. But I think the second piece, which is equally important, is the number of layoffs and furloughs and other things that occurred where people have lost their health insurance as well. And so you have sort of this double whammy where the healthcare systems have hemorrhaged millions of dollars, and now you have an increased need as well for the delivery of healthcare from people that were previously insured and are now not insured. So it's created quite a challenging atmosphere.
We're talking today to Dr. Alex Garza. He's the Chief Medical Officer for SSM Health. That's, of course, in addition to his role as head of the St. Louis Metropolitan Pandemic Task Force, two very big jobs. We're also joined by Paul Ross, the president of the SSM Health Foundation. And we do want to remind people they have this virtual gala coming up. You can find out more information at givetossmhealth.org/events/gala. We need to take a quick break, but we'll be back shortly to continue this conversation. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
Welcome back. We're talking today about cancer care during this pandemic, and we're talking to Paul Ross, who's the president of the SSM Health Foundation. We're also joined by Dr. Alex Garza, who's the chief medical officer for SSM Health, and he is also the head of the St. Louis Metropolitan Pandemic Task Force. And Dr. Garza, you'd referred earlier in our conversation to the fact that we are seeing a bit of uptick in cases in our region. I understand that some hospitalizations have been growing, and that's particularly the case outstate. How are things looking to you right now?
Yeah, so we're in this weird period where we see sort of the cases go up and down, or at least the admissions go up and down, I guess I should say. We've seen a clear decrease in cases from the more urban areas that were the hotspots early on in the pandemic, as well as admissions from those areas. So most of the admissions that we're seeing now are from the outlying areas, so the more rural areas like Franklin and Jefferson County and places like that. And so that's probably a result of the policy differences between those different areas.
It does make you think maybe in the St. Louis region we have a clue of what we're doing. Do you take some comfort in that?
Well, I would have more comfort if the cases were decreasing across the state. But but even if you look at the urban areas on the other side of the state in Kansas City, their cases are way down as well, and there are similar policies between the two metropolitan areas, and so it's the right question to ask.
So with these outstate areas seeing this increase, as you say, an increase in hospitalizations, they're back up. Does that put strain on the systems here in St. Louis, or make you fear future strain? How does that all work together?
Sure. Yeah. And so SSM does have facilities, or we call them ministries. They're hospitals in mid-Missouri as well. And I can tell you from looking at our data, they're one of our highest census now is in our hospitals out in mid-Missouri. So, but your question of patients do come from the outlying areas, and they come into the metropolitan area to seek help. And so, of course, when we're taking care of those patients, and then if we did see an increase in cases within our traditional catchment areas in the city and county, or a bad flu season or something else, it would definitely cause a strain on the healthcare systems. Right now, we're measuring that as percentages of beds and percentages of ICU capacity. We're doing okay. But we're always concerned when we see increased level of activity into some of the areas that are feeding into the St. Louis area.
Mm-hmm. And these SSM Health hospitals that are out more in mid-Missouri, are they at this point doing okay? Are they overwhelmed?
They seem to be doing okay. They certainly have a high census load, but they seem to be doing okay right now.
Well, that's good to hear. And Paul, we talked a bit about your work with SSM Health Foundation and how hard it is to get, to get those in-person meetings, to get people to focus on this. Is this in part just a question of where our attention is right now? We're just not thinking of anything other than this coronavirus.
Yeah, I think it is, and we've seen that shift in the giving to us specifically. The pandemic has created quite an awareness of health, frontline caregivers, who are critically important, and so we've seen a shift. Now, whether that is now long term in terms of folks giving habits and patterns, that's to be determined. But we have seen a focus specifically on health and treating, and responding to the pandemic.
So people when you say there's a shift, you've seen people more interested in giving in that health sphere?
Absolutely. There's been no doubt we've seen a significant response to our appeal to help treat the pandemic, and we've seen that in our case for sure.
Okay. Well, that's great that there's been an influx in interest in that. So that's one piece of hope, I guess, that people are giving and they're being generous. On the medical front, Dr. Garza, what are your biggest areas for hope when it comes to COVID-19 right now?
I think if we as a community can embrace those mitigation strategies, mask wearing, social distancing, all of those things, in order to get those cases down. That would be, that would be welcomed. And then moving into the flu season as well, ensuring that we have high penetration of influenza vaccine would be the other one.
I know.
So
Go ahead.
go ahead. I'm sorry.
Oh, please go ahead.
So typically it's only about 40% of the population that gets flu vaccine. We think there's heightened awareness now, but if we can, bring down the risk of another respiratory pathogen within our community, that would be extremely helpful.
You say there's heightened awareness. Has that translated at this point into a greater than expected number of people actually getting those flu shots?
Yeah, we think so. We've used the pandemic task force to sort of organize around influenza campaigns as well. And so we're starting to track how much vaccination we're giving out to the community. And we'll have some more data on that in the upcoming weeks. It's really just started those campaigns right now. So we're going to track and see, have we seen a difference in uptake in the community? Hopefully we will.
Hearing you talk about using the task force to coordinate and to share some of these numbers together, I know one of the biggest complaints one always hears about St. Louis in any arena, certainly not just the healthcare arena or the healthcare arena even held up as Exhibit A, is just how fractured we are, that we don't talk to each other enough, we don't coordinate enough. Do you think with something like this pandemic task force that you're now leading, that this is going to lead to increased collaboration for people within that healthcare space going forward?
Well, that's certainly the goal. So early on in the pandemic, we recognized that we were much stronger together in looking at the health of the community together than we were apart. And so we've had more than a couple of discussions about how can we leverage the infrastructure that we've put in place, or maybe the organization that we've put in place, to start tackling other things that affect the health of the community. And so things such as, the environment or housing or transportation, any of those other things that really impact health as well. So we're very hopeful.
It also feels like there's an increased awareness of just how those factors, when you mentioned the environment, things like housing, people are understanding how that plays into things like comorbidities thanks to this illness. Do you think you'll be able to seize some of the momentum on that to get people to understand that's also a health issue?
Oh, absolutely. That's the direction that we're going to be going, is looking at those contributors to health that really are much more impactful for the health of the community than the delivery of healthcare. I mean, if you think about the entirety of health in the community, the delivery of healthcare in and of itself is really a small part. It's only like around 10% of the total health of the community. So focusing on those other things, such as the environment and other social and economic justice issues, are extremely important to the health outcomes of the community.
Paul, I want to bring it back to you. You're again the president of SSM Health Foundation. Is that something that the foundation is also raising money in ways that it benefits it?
Absolutely. We're a place where benefactors can turn their philanthropic investment into meaningful impact. And our sole purpose is to propel the mission of SSM Health forward. And community health is a priority for our organization. And so, yes, absolutely, our foundation is front and center at supporting that.
So we've talked a bit about this virtual gala you have coming up. Is it harder to get people interested in a gala when you can't show up wearing an awesome dress, you're not in a fancy hotel, you're doing it online? Is that something where tickets don't move quite as briskly?
Yeah, it is. And what we've seen nationally is that these types of, when everyone shifts to a virtual format or something like that from a traditional gala, everything's down about 30%. And we're seeing exactly that. So we're down just a touch, but there's still significant interest. Our theme this year is Hope Blooms, because hope is one thing that we can be certain of during these challenging times. And so we're excited about the format that we have. It'll be engaging. There's live music. There's inspiring stories. It'll just be from the comfort of your home, rather than a larger hotel or a ballroom.
So maybe we should be happy. We don't have to wear an uncomfortable dress. We can participate wearing something that's comfortable.
Yes, absolutely.
And is it bring your own wine? How does that work?
So, what we do, this is a really neat thing. Everyone who's participating will be delivered a box, a gourmet meal. It'll be delivered to their door, and all they need to do is heat it up. And and then also a bottle of wine will accompany that. So everything's provided. We're calling it Gala in a Box.
Gala in a box. All right. Well, if you want more details about that, www.givetosssmhealth.org/events/gala. And that theme is Hope Blooms. Dr. Garza, I want to bring it back to you because I feel like health is just so important right now, and you have your finger on the pulse of this. What are some things you'd like us to take from this conversation? I know it's important for people to get those regular screenings. That's surely part of it. But anything else you'd like to remind us and that would give us some hope on our way out the door?
Yeah, so a couple of things. So related to our cancer care, the screening appointments and the screenings are extremely important, and we've developed all of the protocols so people are safe when they come to our healthcare facilities, not just us, but across the board at all of the healthcare facilities. And so whomever you go to, make sure you're still fulfilling those screening exams. The second thing is the risk to that specific patient population. So obviously they're immunocompromised, and so we need to be cognizant that even though people can be young, healthy, and it will be minimally impacted by COVID, you do the things like social distancing and mask wearing, not just to protect yourself, but to protect the community, particularly those that are more vulnerable, like cancer patients and chemo patients and other patients. And so those are specific things. And lastly, the best way to get through this pandemic is if we all act together as one community to follow all of those really evidence-based rules. And I would say the same thing as well with giving for cancer care.
I think that's a great point. And as you say, we kind of do have some little focus groups here. We have St. Louis and Kansas City, which are doing pretty well at this point. And we're looking at what they do and how that works. And some other places not doing quite so well. So we might want to take something from that. Dr. Alex Garza of SSM Health, I want to thank you so much for joining us today.
Sure, anytime. Thanks, Sarah.
And Paul Ross, president of the SSM Health Foundation. Thank you.
Thank you, Sarah.
If you learned something new from today's episode, consider leaving us a review and rating on Apple Podcasts on the App Store. It's the easiest way to help people discover our show. We appreciate it. Thank you. Is listening to an episode of St. Louis on the Air part of your daily routine? If so, suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help new people discover our show. Thank you.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.